If you're interested in aging well, you've probably heard a steady stream of advice about diet, exercise, and so forth. Much of it sounds reasonable, and much of it is well-intentioned. Yet many people still find themselves asking the same frustrating question as the years pass. Why am I working just as hard or harder than ever, but getting less benefit from it? This presentation you are about to see begins with that question. Recent research has in fact helped explain why this happens and why certain types of exercise help, not by turning the dial up, but by restoring balance and timing. This presentation will walk you through those ideas and show how a structured approach can help you age stronger, not just stay busy. Hi, I'm Dr. Peter Murano, and today I want to discuss how recent molecular research has reshaped our understanding of muscle aging and how to apply these insights without overinterpreting them. So put on your science hat and buckle up. In particular, we'll look at the FOXO DEF1 mTOR C1 axis, identified by Tang and colleagues, and then view it through a broader lens, not just what pathways matter, but how signals unfold over time. This distinction becomes increasingly important as recovery capacity narrows with age. As this disclaimer indicates, the information that follows is meant to help you better understand how exercise and recovery affects aging muscle, not to replace medical advice. Everyone's body, health history, and recovery capacity are different, especially as we get older. The ideas discussed here are educational and are not one-size-fits-all or medical treatment. Before changing your exercise routine, nutrition, or lifestyle, particularly if you have a medical condition, take medications, or have been inactive, it's important to talk to your doctor or another qualified healthcare professional. The goal of the AMPK mTOR method is to help you adopt a lifestyle more intelligently and sustainably, not to push you beyond what is safe or into something that is inappropriate for you. A central mistake in how we think about aging muscle is assuming that failure reflects a lack of effort. Many older adults train consistently, consume adequate protein, and follow structured programs, yet they recover more slowly and adapt less efficiently. This raises the key question of this slide. Why does more work so often produce less return with age? The answer increasingly points toward how signals are interpreted, not whether they are present. mTOR C1, or mTOR complex 1, I will simply call it mTOR, is indispensable. Without it, muscle protein synthesis, strength maintenance, and structural integrity cannot be preserved, but mTOR is not designed to remain continuously elevated. Its benefits depend on regulation, restraint, and timing. Growth signaling works best when it is episodic, when it rises, resolves, and allows other processes to proceed rather than remaining habitually active. Last year, in 2025, Tang and colleagues provided a crucial clarification regarding mTOR in aging versus young muscle. And here you see Dr. Tang and his research paper that was accepted for publication in a high-impact journal. And here you see the research paper that was published in PNAS, and you can see all of the collaborators listed there for this research titled Exercise Suppresses DEF1 to Normalize mTOR C1 Activity and Reverse Muscle Aging. The researchers discovered that in aging muscle, the problem is often not insufficient anabolic signaling contributing to sarcopenia, but ironically, chronically elevated mTOR activity. Here's what happens. The persistent activation of mTOR suppresses autophagy and impairs protein quality control and also promotes senescence. And these are three scenarios that work against building new muscle. In other words, once mTOR signaling is engaged in older muscle, it is often poorly regulated, unfortunately, and that dysregulation contributes directly to muscle decline. And now for the technical part. The key mechanistic contribution of this new research is the identification of what is called DEF1, a molecule that acts as an upstream driver of excessive mTOR activity. DEF1 increases mTOR transcription, leading to persistent mTOR activation. A different molecule called FOXO acts as a brake on this process, and fortunately, exercise activates FOXO, which can then suppress DEF1, thereby restoring control over mTOR. The critical insight here is that exercise helps aging muscle by restoring regulation, not by amplifying the growth signaling further. Let's look at the figure published by the researchers in the article and try to understand it. As you see, the figure here contrasts young and aging muscle. So look at the top, the young muscle. We have mTOR activity being responsive and regulated, and autophagy, which is, as you may recall, cellular cleanup, remains intact, and growth and repair then coexist. This is a good situation. But in aging muscle below that, you see that DEF1 becomes overactive. mTOR then remains chronically elevated. Autophagy is suppressed, and muscle quality declines despite ongoing protein synthesis. The conclusion here is that this is not a problem of external motivation or effort by the person. It is a problem of their internal signaling regulation. Okay, so we looked at the figure, and this slide is giving us everything in terms of words. And I just want to emphasize with you that the aging muscle situation is newly understood. mTOR can be activated, and it can initiate muscle protein synthesis in old muscle, but the difficulty arises apparently when mTOR, it just doesn't shut off. And this is due to the DEF1 impact on mTOR C1. And the solution appears to be exercise, at least in part, because exercise will silence DEF1 sufficiently so that mTOR activity goes back to what it should be. But also we're going to wonder, what's the role of AMPK in this scenario? So we'll be talking about that in just a jiffy. I want to mention what the study does not claim to do, because it's equally important to be clear about what the study does not claim as well as what it does claim. It does not argue that mTOR should be avoided, or that anabolic signaling is bad or harmful, or that suppression of mTOR is the goal. Nor does it prescribe a weekly training structure, timing strategies, or long-term organization of signals. What it is, it's purely a mechanistic insight, not an exercise or a training framework. This is actually where the AMPK method enters the discussion. The method begins where molecular studies like this new research necessarily stop. As author of the AMPK mTOR method, I can now ask a different question. If aging muscle suffers from chronic anabolic dominance once signaling is engaged, how should anabolic and repair signals be structured across days to avoid that outcome? Now, the AMPK mTOR method is a timing framework, a blueprint for signal separation and weekly rhythm. It does not claim to directly modulate DEF1. intervene at the molecular level, or replace established exercise biology. Just as importantly, it does not attempt to chronically suppress mTOR signaling. That would be as biologically problematic as allowing mTOR to remain chronically active. Muscle maintenance and strength depend on periodic, robust mTOR activation. Eliminating or continuously dampening that signal would impair protein synthesis, MPS, structural integrity, and functional capacity as we age. The problem in aging muscle, then, is not that mTOR activity must be minimized, but that it must be properly constrained in time. It must be granted time to flourish, and then time to diminish. The AMPK mTOR method addresses this by allowing mTOR to activate strongly and purposefully on designated mTOR days, while ensuring that it is not continuously reinforced across the week by alternating with AMPK days. In doing so, the method avoids both extremes, chronic anabolic dominance and chronic anabolic suppression, you see, and instead preserves signal clarity by restoring a biologically appropriate rhythm between growth and repair. Now, the central idea here that I am speaking of is temporal architecture, a time-structured framework. This makes biological sense because aging muscle adapts better to clear signals distributed over time than to mixed or continuous ones. Growth requires mTOR activation. Repair requires release from mTOR dominance, plus a chance for AMPK to activate. That's where we get autophagy and other beneficial functions. These processes cannot occur optimally at the same time every day without interfering with one another. So let me mention mTOR dominant days. These are designed for deliberate growth. They emphasize resistance training, adequate protein intake, and clear anabolic signaling. On these days, mTOR is activated strongly and purposefully. This directly addresses the very real risk of understimulation that contributes to muscle loss in many older adults. They simply do not engage in strength training, and they do not consume adequate protein. However, there's still the risk in older adults who do engage in strength training and adequate protein for anabolic dominance. But we have to realize that AMPK can prevent this, and as the new research suggests, the right kind of exercise on an AMPK day is what I identify as the endurance type cardio, and is simple. On mTOR days, resistance training, that's lifting weights, for instance. On AMPK days, it's endurance training, not resistance training. So it's zone 2 cardio and endurance activities. Yes, so compared to mTOR days, AMPK dominant days serve a different purpose. They're not build days, they are repair and restoration days. They emphasize, as I've said, endurance or zone 2 activity, a reduced feeding window, metabolic stress signaling, and conditions that allow autophagy and mitochondrial maintenance to proceed. These days interrupt the chronic anabolic tone that surges past what the actual baseline level should be, and in so doing, create biological space for repair processes to complete. And this turns out to be so very, very critical. Now, the new research shows that chronic mTOR overactivity is harmful and that exercise of a certain type restores regulatory balance. The AMPK mTOR method aligns with this logic by preventing chronic mTOR bias through time separation of growth versus repair signals. Now, I'm not claiming that Professor Tang proves the AMPK mTOR method with his research, but it does show something quite critical and relevant, conceptual convergence around the importance of regulation and balance. I need to be clear on this. Regulation is not the same as suppression. Continually dampening mTOR risks replacing one chronic state with another. Just as we do not want constant mTOR signaling, we do not want constant AMPK signaling either. If AMPK dominance were to occur, muscle loss and frailty would be the result. Optimal muscle health depends then on contrast, on rhythm, and on alternation. The method preserves signal contrast rather than attempting constant modulation. Now, I want to say a few things about AMPK days and why they matter, and I can say from experience as a strength trainer of older men that a lot of the time the focus seems to be, I want to grow muscle, and we're not thinking about the bigger picture here. The bigger picture is we have to recover from the growth days of mTOR days, and we have to alternate with AMPK days for very real reason, because AMPK clears out debris and sets the stage so that mTOR can come in and do its job. So we need to appreciate that AMPK days are not anti-growth. They actually do set the stage for it. AMPK days reduce baseline anabolic tone, true, but this is necessary to allow cleanup processes to proceed and restore sensitivity so that the next anabolic signal on the coming mTOR day will be optimally effective. And in this way, AMPK days complement FOXO-mediated restraint, as mentioned in the article, without claiming direct molecular overlap. So the next slide, the real differentiator. Well, what I'm talking about here is that in the health-focused mindset that's out there, most of the people interested in exercising their way to better health think about specific training programs and ask which exercises to do. And this is, of course, natural. The AMPK-mTOR method is not emphasizing that question. Instead, it asks something else. Which or what biological message is being sent today in my body? And just as importantly, what message is not being sent? Now, this shift in perspective is the real differentiator. Exercise does not enter into the equation. Cardio on AMPK days and strength training on mTOR days. But I think you see the point that I'm making. Now, speaking of exercise, as a personal trainer, I see many programs out there that involve clients needing to be in the gym and working out 4, 5, or even 6 days a week. Split routines, perhaps working the arms and shoulders on Monday and Wednesday, back and legs on Tuesday and Thursday, are quite popular. The problem is a weekly cluster of 4 or 5 or 6 consecutive resistance training days does not allow for sufficient recovery cycles. They often become mTOR-biased days and mTOR-biased weeks, unfortunately with suppressed repair. This runs the risk of the anabolic dominance effect. That is exactly what was presented in the new research that we covered. Clear alternation would restore the proper signaling environment, both in muscle and systemically. So I see that we're getting toward the finish line here, and the main takeaway, or governing principle, if you will, that is being shared through this presentation is simple. mTOR should be activated strongly and purposefully, but episodically, not habitually. Now, this matters with aging because the recovery bandwidth narrows, signal noise increases, and blurred messages stall adaptation. And I mean desirable adaptation, like building muscle and improving your VO2 max. The key to remember here is that clear signals outperform mixed signals across the board when recovery capacity starts to decline with age, roughly from age 60 onward. Okay, as a quick recap, here are 3 key takeaways for us. 1. The new research reveals what goes wrong at the molecular level with aging muscle. 2. Exercise can restore balance through the FOXO DEF1 mTOR axis. And 3, the AMPK mTOR method addresses how that balance can be preserved over time, not by maximizing pathways, but by organizing them in time. In this way, the method does not compete with the biology revealed by the new research, it operationalizes it. It translates molecular insights about regulation, restraint, and balance into a practical framework that respects how aging muscle actually adapts over time. Thank you for taking the time to stay with me throughout this presentation. I know it's been a long one. I also know that there was a lot of technical information that may require repeated exposure to it before making sense. So allow me to leave you with these thoughts. As we age, it is easy to assume that declining strength or slower recovery reflects a body that is simply wearing out. But the emerging science tells a more hopeful story. Aging muscle does not lose its capacity to adapt. It loses clarity in the signals it receives, and we can do something about that. When effort, recovery, and timing are aligned, the machinery of repair and growth remains remarkably capable, even later, much later into life. The research we have discussed shows that muscle health is not restored by doing more, but by doing things in the right order with the right intent. By respecting the natural rhythm between building and repair, older adults can focus their biology rather than fight it, and in so doing, age stronger, more resilient, and more confident in what their bodies can still achieve. I'm Dr. Peter Murano, wishing you all the best.